I have another wonderful health transformer coming up. His name is KP Yelpaala. He is the CEO and founder of access.mobile. Welcome.
Hi, how are you doing?
Hi, I didn't get to talk to you earlier. I'm so excited that you're here.
Yeah, likewise.
So talk to me about what you're working on at access.mobile.
So what we're working on at access.mobile is how to use mobile communication to personalize patient engagement so that people could get better access to healthcare information and services.
How are you guys doing that?
So we do that primarily through text-based interventions and using data science and behavioral science to really connect with people in ways that move them. Because we believe that ultimately patient engagement should be about behavior change. And so if we can communicate with you in a way that's personalized, then we're more likely to have you take action in a way that's meaningful for you.
I think what fascinated me so much about what you're working on is the multicultural aspect.
Yeah.
Tell me why that was important to you and how you're addressing that.
So part of why I founded access.mobile is because for me personally, I have some experience with access to healthcare challenges in my family. So both my parents are from Ghana and I was born in the US. So having family in an African country where there's limited access to quality care, I always wanted to do that work. But what I realized in the African context is despite some of the limitations in access to care, everybody had a mobile phone. And so I started to think about how that mobile phone could be a tool in an environment with lots of different cultures, languages, and other challenges, and how we better connect people. And that's been a way that we've built that model, not just in African countries, but also the US.
So where are you in the development of all of this? How is it expanding and serving?
So we've had a couple really nice milestones. So we launched in the US in 2018. And the company I founded in 2011, so a lot of the origins were in African countries. And in 2018, we landed our first client in Los Angeles, doing multicultural and multi-language communication for patient engagement. And now we're also scaling in South Africa, working on a large-scale initiative for HIV patients to be able to better access drugs and treatment using patient engagement in 11 different languages.
So how does someone find you? How would they get access to access.mobile and start participating?
Well, so they can reach out to us on social media or through our LinkedIn page. Also info@accessmobileinc.com is where they can email us. And we're looking for partners here in the US and internationally that really want to be intentional about how they connect with their patients and thinking about culture, social determinants of health, and all those things.
What's the biggest challenge in doing something so innovative across culture?
I think that the biggest challenge is thinking about scale. Because in certain ways, I would like to say that as human beings, there's ways that we're connected around the world and there's similarity, but there's also differences. And so when you start to scale in lots of different cultural environments, the tension is how do we do things that are culturally relevant while also trying to expand our footprint to lots of people. And I think that creates a little bit of a healthy tension.
So is this helping people reduce their cost of healthcare?
Exactly. So with our clients, what we're really doing is by driving certain types of behavior, we're associating that with better health outcomes, which really drives quality and reduced costs.
Beautiful.
Yeah.
KB, it's been such an honor to meet you and to hear what you're doing to impact health and wellness worldwide.
Thanks so much.
Thank you so much.
Appreciate it.
Have fun at the conference.